Thank you for coming out to Concerned Ontario Doctors public rally to highlight the ongoing Liberal healthcare cuts that are impacting patients right here in Ottawa-Vanier. Thank you for joining us. We are all here because Wynne and her Liberal government have recklessly cut funding to your healthcare. These cuts are thoughtless, short-sighted, and harmful to our patients. These cuts have created less access to care and longer wait times for patients across the entire province, including right here in Ottawa-Vanier. I know because my colleagues and I have tracked, verified, and mapped out the impact of these cuts across the province. It has left the most vulnerable of patients without the care that they so need and deserve. And that is why we cannot be silent anymore. The nearly $1 billion in cuts to physician services has forced many physicians to close clinics, to relocate, or to retire earlier than planned. As of now, nearly 1 million patients in the province are without a family doctor.
Double shame!
Shame!
By the end of this year, more and more family doctors in Ottawa will be forced to retire earlier. Where will these patients go? With walk-in clinics forced to close, orphan patients have no choice but to flood emergency rooms. Ethically, with wait lists quickly mounting to over 1 to 2 years for overworked specialists, they cannot accept new patient referrals as they are unable to provide care in a timely manner. This is happening all across the province, from psychiatry and orthopedics to neurology and oncology. Access to these essential services has been severely restricted because the provincial Liberals refuse to match funding to actual patient need. Not surprisingly, ERs in Ottawa and across the province are unable to handle the mass of patients seeking care. Patients are creating code gridlocks across the province. This is when patient care needs exceed hospital resources. When this happens, elective procedures and surgeries are canceled and patients are admitted to hallway stretchers instead of hospital beds. This indignity and lack of respect for our seniors who have spent a lifetime contributing to our healthcare system as taxpayers is completely unacceptable.
Shame, shame.
Because of financial mismanagement, the Liberal government has been responsible for the cancellation or rescheduling of hundreds of medically necessary surgeries. Wynne's government is rationing patient care to balance their budget. As patients wait in pain and suffering, Ontario's ORs simply sit empty. Nursing layoffs have followed, and highly qualified surgeons have left the province. Without any consultation with physicians, the Liberal government has now introduced Bill 41, the Patients First Act. This bill will fundamentally change the face of healthcare in Ontario forever. It will allow for the expansion of an already bloated healthcare bureaucracy. Once passed, Bill 41 will grant the Ministry of Health absolute authority over anything and everything to do with Ontario's healthcare system. From LHINs to home care to hospitals to private-based community medical clinics. Under this act, provincial medical standards will now be determined by politicians and bureaucrats instead of by medical experts.
No way! Shame! Shame!
The Liberal theme of prioritizing bureaucracy over frontline care is evident in its intent to create 80 or more new sub-LHINs. At a price tag of $90 million a year, the LHINs were just criticized last year by the Auditor General as being an ineffective, expensive drain on the healthcare system. And yet, in this already strained system, Wynne's government is choosing to waste millions more on unnecessary middle management. Under this new bill, government-appointed investigators will have the legal right to enter physicians' clinics and review any and all documents, including private patient medical records. This breach of patient privacy is utterly unacceptable. Bill 41 is a direct threat to patient privacy. It gives priority over bureaucracy. and is another example of this Liberal government's aggressive and overly paternalistic approach to patients and the healthcare providers that provide care.
She'd be in jail.
Ontario's patients need stability. It is our government's provincial obligation to provide adequate funding for healthcare. It is the one primary provincial mandate that impacts every single citizen of this province from birth to death. We need the provincial Liberal government to adequately fund healthcare and work with physicians and frontline care workers to reform healthcare. The facts speak for themselves. Ottawa-Vanier now has an opportunity to send a very clear message and speak up against this Liberal government's ongoing healthcare cuts. Vote for a candidate that will challenge the Liberal rhetoric and will work towards ending this healthcare crisis and the far-reaching impacts of Bill 41. Vote for a candidate that will be a champion for your healthcare and who will demand care, not cuts.
Knock 'em off for Vanier.
Wynne for prison!
Wynne for prison. Drain the swamp.
Drain the swamp!
Drain the swamp.
Wynne for prison!
I'm now going to ask the two local Ottawa-Vanier physicians to join me, and they're going to say a few words. Dr. Francis Dubé.
My daughter.